Good evening. Welcome to a community conversation on the current situation with the coronavirus outbreak. We are live streaming this discussion tonight and looking forward to your questions. You can send those questions through Facebook chat or via text message to 571-356-9267. Let me introduce our panel for this evening. With us, County Manager Mark Schwartz, Public Health Director Ruben Varghese, our Director of Emergency Management, Aaron Miller, and the Assistant Medical Director for the Arlington County Fire Department, Kate Kramer. I'm Jim Schwartz, also with the County Manager's Office, and I will serve as your moderator for this evening. Let me first turn to Mark for some opening comments.
Thank you, Jim. With coronavirus, COVID-19 in the news recently and likely to remain in the news for quite a while, we wanted to take an opportunity tonight to address some of your concerns and provide you with information and updates and give you an opportunity to ask questions. There's a lot of information already out there by the Centers of Disease Control and our state health department, but we realize that people have a lot of questions. We're going to go through some of the steps you can take to help protect yourself. And this is probably going to be the first of what may be many chats on this subject. So with that, back to you, Jim.
Good. Thank you, Mark. Dr. Varghese, you and your team have been working on this now for better than 6 weeks. Why don't you share with us what you've been learning and the situation as it currently stands?
Sure. Thank you, Jim. First of all, I want to reassure people, I think public health, the system has been working very well in Arlington, reminding everyone we have had the experience of responding to influenza pandemic with H1N1. We've responded to Ebola, and the same system exists, and the medical providers, the hospital system, and public health have been working well together and have been able to do the testing, identify people who may be at risk, and it's been a wonderful system. It's a shame we have to use it, and yet we do very well. And so I understand people are concerned, and there are things that we can do, and I believe the system has been responding, including tonight.
Good. While we're on the conversation about what's been going on, how the situation is evolving, we've been getting questions already about whether or not there are cases here in Arlington.
Sure. There have been no cases identified in Virginia, DC, or Maryland to this point. For confidentiality reasons, the Virginia Department of Health has a policy of not identifying by jurisdiction cases because people may go and look for those individuals. We can, in the aggregate, say 6 individuals have been tested in the Northern Virginia area. 5 of those results have come back, and they are negative, and 1 is pending.
Good, thank you. Aaron Miller, as Director of Emergency Management, you are acutely aware that since 9/11, this community has been especially mindful of the preparations that individuals and households need to make for a variety of emergencies. How much of those preparations apply in an instance like coronavirus?
It's a great question. You know, the foundational aspects of preparation, including making a kit, getting a plan together with your family, and staying informed through signing up for Arlington alerts. Those 3 things really form the foundation for being able to respond to any emergency. And coronavirus is no exception to that. We're encouraging our residents and our community members to continue to do that, to take those steps, relook at your plans, and in particular, your communications plans with your family. Update that information and make sure that you stay tuned not only to programs like this, but also pay attention to Arlington Alert for the most up-to-date information.
So just coming back to the issue of supplies and people making preparations, one of the questions that we've gotten is around things that you might want during this particular crisis. Hand sanitizer, which is turning up with some difficulty to find in some places. What can you advise about acquiring supplies in a time like this?
Yeah, so the time to prepare is before emergencies, obviously, but in these stages right now where we're still monitoring and determining the course of action that's necessary, take this opportunity to relook at your kit. Stock those basic things, right? Food, water, medications, and you want to have a 90-day supply of those things. If you've got pets, if you've got children, if you've got individuals who have special medical needs within your household, pay attention to those items and use the opportunity to refresh. As far as specialty items like hand sanitizer, the advice of our public health professionals stands. The best course of action to protect yourself from germs is washing your hands with soap and water. And Dr. Varghese obviously has a lot of information for you this evening about that.
Good, thank you. Kate, turning to you. It's possible that if we see people getting sick here in Arlington, our fire and EMS department may be called upon to act. Why don't you talk a little bit about the preparations that the fire department is making right now?
Sure. So as Dr. Varghese said, we have pandemic plans that have been in place for a long period of time. They're being revised again and looked at again to make sure that all of those plans are operational and appropriate to this situation. We have, the fire department has been working for over a year now on our Make the Right Call campaign, which really emphasizes to citizens to use their 911 services appropriately so that we can reserve our emergency services for those who truly need it. So as the situation evolves, as we continue to speak with our public health officials and with the CDC, we're very much relying on their guidance, but we are taking steps, we are planning, and we just want to make sure that we have the appropriate response. We've done a lot of training with our staff to remind them of the appropriate PPE to use, and donning and doffing and making sure that we aren't contributing to the spread.
So you mentioned personal protective equipment, PPE. Dr. Varghese, there's been a lot of questions about steps that the average person in the community can take around protecting themselves. And in this particular issue, the issue of masks comes up quite frequently.
It's a great question. Masks are very important, but only in certain settings. Masks are most effective in the healthcare setting. When you see people in the community using it, the only real appropriate use is for someone who is actually sick to try to prevent the respiratory secretions from getting out. Otherwise, it's really actually quite appropriate to have those masks reserved for the healthcare setting, because we need our doctors and nurses in doctors' offices and hospitals to actually have the protection so that they can see you safely and be available to care for many individuals. So that's the context that we need to remind people. And there are ways to protect yourself that don't require a mask, that are the tried and true public health activities, which I just want to remind people: washing your hands for 20 seconds at least with soap and water. That gets rid of the germs from your hands. And even if you do, we don't want you to touch your mouth, your nose, your eyes. Those are the portals for how germs get into the body. So germs like flu and coronavirus get in that way. So please do not touch your face if you can. Cover your cough with your elbow or a tissue. If it's a tissue, dispose of it and actually then go wash your hands with soap and water. As Aaron talked about earlier, hand sanitizer is useful if you cannot get to soap and water. So please, everyone, start thinking about, is that really a convenience, or can you actually make the time to go to the bathroom to wash your hands? I think we have to start thinking about things differently. Let's be effective in protecting our community and ourselves, and go use the restroom and wash at a sink rather than going for hand sanitizer.
Hand sanitizer is not a replacement for soap and water. It's only something when soap and water are not immediately available.
Correct.
Good. Mark, let's go back to you, because there have been questions that have been asked about the status of public meetings, public assembly. Obviously, as government, we assemble people for a lot of legitimate reasons. What is the county currently saying about those gatherings?
So as of right now, there's no specific reason to cancel public meetings. And the advice we're giving, which is the advice that we've actually had in place for quite a long time, is if people are not feeling well or ill, they should not come to those public meetings. They should stay home and take care of themselves. And we will be working with our commissions and other county bodies to make sure to see how people could participate remotely. There are some limitations in the way people can participate remotely that have to do with some provisions of law I don't want to get into right now. But for right now, people should plan to come to meetings and make sure that you look out for yourself and for those people around you. If you're sick, stay home. And there are, as we're doing tonight, sort of modeling that, there's different ways to communicate with people, and we encourage you all to use the technology that you have to get in touch with your co-commissioners within the bounds of the rules that we have, and also to just continue to stay informed, because if that situation changes, we will let you know.
Good. Dr. Varghese, back to you. There's been media reporting on the topic of testing, and we got a question in from a viewer or listener tonight. What is the process for getting tested, and has testing been done in Arlington?
Sure. As we've mentioned before, we have arranged for the testing. It's usually done in the hospital for the way the CDC criteria had been going on currently. And so in Arlington and in other places, tests have been sent down. And then they were sent down to the Virginia Department of Health's lab and then to CDC for the actual testing. CDC has now given access to that testing to Virginia, and so now testing can be done in the state. So testing in public health circumstances can now occur in the state. For general testing, if the capacity at the health department is not there, they will send the test to CDC.
Okay, excellent. So looking over some other questions that we have received in advance of our starting this evening and some since, just looking at going back to the issue of sort of looking forward, if we were to have a spread within Arlington, things like outdoor activities, playgrounds for kids, will they be kept open, or will that be something that we would have to limit access to?
Sure. In all of these circumstances, it's going to be on a case-by-case basis about how much disease do we think may be occurring in the community and what would be best. And it goes back to, once again, more community gatherings than are things specifically closed. So if people can do things safely, we're going to still encourage you to go out and do the appropriate things, because exercise, consider play a form of exercise, is going to be just as important to keep people healthy, including the children in our community. So it's going to be a balancing act of how do we get people to be able to do what they need to and protecting people from getting exposed. And so that's why we have to remind people, if you stay home and you're ill, then other people can actually congregate and take care of themselves, wash their hands appropriately. So if we do those sorts of things, I believe we can have the best balance. We're not taking it off the table as a possibility to consider, but we always think in terms of how do we allow things to continue so that people can actually live well and protect themselves.
So another question that has come in from a viewer, and I'm going to start with Aaron. I'm a business owner. What can I do to prepare my employees? And then Mark, I'm going to go over to you because you've actually communicated with the Arlington County workforce recently about this topic, and you can talk specifically about what that looked like. So
as I mentioned before, one of the things that we encourage with our residents, and also that we encourage within county government, is having that sort of base plan. The continuity of operations for your business as well as for our government departments is something that you should think about from an all hazards approach, not just with coronavirus, but also with other things that may threaten, for instance, severe weather. In this particular instance, there's specific guidance that is available to business owners from the Centers for Disease Control as well as the U.S. Chamber of Commerce. You can visit the CDC website on coronavirus. You'll see some resources that point specifically for business owners so that they can receive more information and some specific guidance for those cases.
Mark?
And so, Jim, the questions we were receiving, at least I was receiving from the workforce and from supervisors, were people who had traveled to China or to the other countries that are listed on the CDC website were coming back, and the question was, should we welcome them back into the workforce? And so today I sent out a memo to all county staff saying that if individuals have traveled to those countries that are on the CDC list, that when they return, for the 14 days after they have returned, that they should not come into the workplace, but instead should stay at home and telework Now, not every job is capable of being teleworked, and we don't want to penalize employees for that. So we'll tell them still to stay home for 14 days without any loss of pay. But those are the kinds of things I think that businesses should be thinking about. In our case, I think it's very few people who have actually traveled to those countries, and so it's going to have a very, very small impact. But consistent with what Aaron said, it is also part of our continuity of operation plans. As we do this on a very small scale now, it could presage what we might have to do on a larger scale later, and sort of exercising your motor memory or your muscles, your muscle memory on this is a good thing, I think, to have happen. And should be no stigma attached with these people coming back. They're perfectly healthy as far as we know, but we thought it was a legitimate step to take at this point.
So very much related to this, we actually have a question about, and not surprisingly, spring break is coming up. People have trips planned. Where can people find more information? You've already talked a little bit about businesses, but where else can people find information about what the areas that are right now directly affected by the outbreak?
Right. So the Centers for Disease Control website actually lists travel advisories by country with specific guidance for those groups of countries. So for example, it has level 2 countries, and that right now includes Japan. And if you click on the link on the CDC website, that it provides you the specific information and guidance for travelers returning from those countries. It lays that out for each specific country and lays out the associated risk. That information is done in conjunction with the U.S. State Department as well as Customs and Border Protection. Travelers who are re-entering the country, and Dr. Varghese can speak to this a little bit more, receive information and guidance through medical screening procedures based upon the risk associated with transmission in that specific area or country.
So thank you, Aaron. We have been working with the CDC with the travel restrictions with, for example, the 11 airports where folks traveling from mainland China have been filtered to. And so when we get that information, we've been working with the travelers to make sure that they don't have symptoms. If they don't, help them maintain self-quarantine, and those with symptoms, self-isolation. People have been able to do that with minimal support, and the staff in public health are available 24/7 to them to make that follow through.
So a lot of this focus for travelers has been those coming from the countries that were affected before the United States. But now we have people from Washington State that have succumbed to this illness. New York, Rhode Island, other states have identified people. What occurs within the continental United States with regard to notifications? And it's easy for people to go to the website and see that I should not go to Iran. But now that this is here, our own domestic travel could be affected.
Sure. I think people just need to be smart in general. One of the things that the CDC has put forward, and I support, is ask the question, is the travel essential? We're going to leave it up to you to decide what essential means. If it's essential, you make the plan. But if you don't need to travel to areas where there's evidence for community spread, then delay or postpone that trip. That's, I think, the best way we can handle this, because I think we will see waves of this potentially, just like flu season. Make what's appropriate a plan for yourself, and if it's essential, take all of the measures we're doing here with you, so that if you have practiced the right habits, you're going to protect yourself, you're going to be in the best position possible.
Regardless of where you are.
Exactly.
So we have a question from Leslie, who's watching. Thank you, Leslie. Are there any specific extra precautions that should be taken for children?
Excellent question. There is no evidence right now that children are at more risk based on the information coming from China. In fact, it seems to be adults, older adults, and those with chronic medical conditions. Having said that, we want to protect all age groups, and children in other outbreaks like flu are often sometimes the people who may spread illness more or be carriers. So we want to reinforce with our children what the proper behaviors are. So make sure that they're washing their hands, covering their cough, avoiding touching their face. Did you take your children to get flu shots? Why are we pushing flu? Because you don't want to get both illnesses at this time and compromise yourself or the rest of our community. Make sure your children stay home when they're ill. Do not send them back until they're fever-free for 24 hours and without symptoms. I know it's tough, and this is a way to make sure they recover and we protect our whole system from the spread of germs.
Kate, we have a question from Diane that I'm going to give to you. The question is about, it's similar to the question about masks. Should we be thinking about disposable gloves? And then maybe answer that also with some background on what kind of precautions are first responders taking? What's going to look different today that the first responders are doing?
So I would urge caution with relying on gloves to solely protect you from anything, as a lot of exposure happens when you're taking off gloves and you kind of rely on this rely on the fact that you have this barrier when you might not see a microscopic tear, you might not see any sort of other barrier. So I would use caution with that. Gloves are great and they protect against kind of gross contamination rather, but you still need to wash your hands. You still need to effectively wash your hands 20 seconds with warm soap and water. And we have done a lot of training with our staff, reminding them about when you go into a patient's house, now when you exit that house, let's take those gloves off before you now enter the ambulance and try to not contaminate the outside of the ambulance, putting on a new set of gloves once you are then in contact with the patient, and just be really cognizant of what you're touching when you do have gloves on, because they aren't, they can spread disease just as much as they can prevent you from getting disease as well. The one thing that the fire department is working on once we see a bigger spread of this into our community is protecting our workforce as well as maintaining the quality of care that Arlington residents expect from the fire department. So ensuring that our staff is staying healthy, remaining healthy, trying to limit the amount of personnel that might enter a facility if someone is exhibiting flu-like symptoms. We already have our emergency communication centers screening for patients with flu-like symptoms and then asking additional screening questions so that when our responders do need to respond for someone having a true medical emergency, they can be as prepared as possible and making sure they are putting on the appropriate level of personal protective equipment before they enter the facility. And then, something that we're working on in the future is a potential for having a telephone type triage system where we're really making sure those resources are effectively going to the person who's truly in need of our resources.
Good. Aaron, you work very closely with your colleagues in emergency management across the region, and in addition to the professional emergency managers, you have frequent interaction with the Washington Metropolitan Area Transit Authority, WMATA. So we have a question from Diane about riding the Metro. Metro recently came out with some things that they were doing to increase their cleaning of buses and trains. But why don't you talk a little bit about riding the Metro or buses for that matter?
Right. So, great question, Diane. I think one of the things that we want to stress, and we continually go back to this, and you'll hear us say it over and over again, is the best thing that individuals can do is practice good hand hygiene. Make sure that after you do touch surfaces that may be heavily utilized, for instance, in public places, that you're careful not to touch your face. As Dr. Varghese said, good hand hygiene, making sure that you're not spreading those germs, the eyes, the nose, the mouth, not just coronavirus, but flu. We've, still are in flu season, and other respiratory illnesses are easily spread that way. And so we want to make sure that you are as disciplined as possible with that. And remember to wash your hands with warm soapy water for 20 seconds. That's the best advice that we can provide to folks in order to stay safe.
Just to go back to this issue of hand washing for a moment, because we tend to think about washing our hands in particular instances when we've gotten them dirty, when for some reason we believe that something sticky is on our hands. But in reality, this is the time of year when we ought to just be washing our hands periodically during the day, right? Because to use the Metro example, they may have disinfected that Metro car before you got on it, but 5 minutes after that, somebody who is ill may have touched the very, handhold that you're touching. So reinforcing that hand washing should be done just periodically throughout the day, regardless of what you've touched or feel like you may have been exposed to.
Correct. I think people think that they'll be able to see germs, and we have to remind ourselves we can't. And so even after cleaning, the minute Metro or anyone comes on board, they're bringing the germs that are already in their hands. And when you touch a strap, touch the pole, whatever it is, you need to do that. But you have actually now potentially have now new germs on your hands. So we're not saying we want you to write Metro, but when you're able to, either use a hand sanitizer if it's that important that moment, or when you get to your destination, wash your hands. That's actually a practice that I think we need to start getting back into. When you show up at your workplace or wherever it is, enter the building. Before you introduce germs to anyone else, go to the bathroom, wash your hands with soap and water. You're leaving the germs that you were bringing in out. And same thing, when you get home, wash your hands. It's a good way to just stop germ spread.
So we've referenced a couple of times that before we got to coronavirus, we were already in flu season. Flu actually does significant damage in this country every year, with lots of people getting sick and, in fact, perishing from that virus. We have a question that goes a little bit to what's different about coronavirus and flu, and specifically, the text message that came in was asking, is there a particular symptom that stands out with coronavirus that's different from flu?
Sure. Great question. We're still learning a lot about coronavirus. The symptoms that the CDC and the WHO, the World Health Organization, have been focused on are identifying people with fever, cough, and shortness of breath, which can indicate some of the severe illness going on to pneumonia. Those are some of the same symptoms that can happen with flu. The important thing, the real difference, other than they're both being respiratorily transmitted, is we have never seen this virus before, whereas other than in a pandemic flu strain, we've seen flu before. And so there is appropriate reason to be a bit more cautious or concerned about coronavirus because we're not immune to it as we may be with a flu. Having said that, the vast majority of people in China, it's looking like they've survived and are doing fine having been exposed to coronavirus. We are looking to get more information from China, and we know that they're starting to conduct what we call antibody studies to see how many people may actually have been exposed and maybe had very mild illness that we weren't aware of. So yes, it is concerning that people die from it and that it's typically the elderly and those with chronic illnesses. The way we can protect them and others is by doing the habits we've been talking about so that we provide a cocoon, and we're going to get more information from these studies. So that's why it's very good that the WHO and CDC are working with China to help us learn more about what's going on so we can better protect all of you here.
So sticking with you, Dr. Varghese, we had a question from both Vanessa and Lindsay who observed first that Arlington has a lot of apartment buildings and asked if someone in a high-rise building is diagnosed with a virus, will the whole building be quarantined? And it's probably a good time just to talk a little bit more broadly about quarantine, in addition to answering that question, just a little bit about quarantine.
Okay. Let's start with quarantine and isolation, just to define the terms. Let's start with isolation. When someone is sick, when you ask them to stay at home when they're sick, that's a form of self-isolation. When we're talking about quarantine, it's we believe they've been exposed, or we know they've been exposed to someone with the specific germ or illness, and we're asking them to stay home as well to try to prevent the spread if they should get sick before they're aware themselves. So that's just the concept of what those terms mean. Whether it's a high-rise or a home, a single-family home, it's really about how air handling is done in these facilities. And as far as I know, the vast majority, actually, I think because of the building code, we have very good air handling in all of the high-rise buildings. So it should not lead to spread within these areas. And those are still going to be the things we're going to be investigating. We do this routinely, for example, when we investigate cases of TB, tuberculosis in buildings. We ask questions about the air handling system as part of our investigation and confirm that those things are working. If they are, then if they're separate air handling and there's no exposure, then we're going to say you're comfortably safe in those areas. And you still need to do the same behaviors. Do not touch, or if you have frequently touched surfaces, clean, clean, clean.
Mark, we touched a little bit on the way we work with our regional partners. We did get a question in about, a lot of our focus rightly tonight is talking about what we're doing in Arlington. What do you know about what our Northern Virginia partners and even, expanding out to the National Capital Region? What's going on there? And if you could specifically focus a little bit on how we coordinate during these kinds of situations.
Right. So this situation we're facing with the coronavirus is for us going through a series of steps and practices we've had in place for many years. Today, for example, when this note went out to our workforce about the 14 days, taking a 14-day break, we immediately shared that with the Metropolitan Washington Council of Governments and their Homeland Security Group. They have a very, very extensive network of information they're sharing among myself and my colleagues, and also, Aaron sits on a group. We have the fire chiefs and the public health officers who are in constant communication with each other, sharing information about what are best practices. And so I'm going to pay close attention to what I'm hearing, and there will be suggestions of ideas that we can pick up. Also, the sharing of information, and as I know Dr. Varghese and everyone has always told me, the hardest thing to get right is what's actually happening. So we go out of our way, for example, when we were testing someone, to let our colleagues know about what's going on and update them on that information. So there's constant sharing and it seems like constant conference calls.
So Dr. Varghese, a couple of questions for you. Are there over-the-counter medicines that we should be taking to help prevent the spread of coronavirus? And closely associated with the next question, or actually two questions, how can we best clean our offices or homes? And then a different questioner wanted to know, is there a type of soap that is best to use?
Okay. I may need reminders of all of those, but working backwards. Soap, any soap is effective. You do not need, first, you'll hear about antibacterial soap. First of all, this is a virus. Antibacterial soap will not work on viruses. You do not need antibacterial soap in general. The purpose of soap, basic lesson, is it's a fat. Germs have fat. If you've heard the term in chemistry, saponification is the only thing I remember from high school about chemistry and medical school. Sorry. It pulls the fat off and moves the germ off your hands with the water. So you just need soap in any form. Now, if we're talking about, what was the next question?
Cleaning your offices and
cleaning
homes.
So
Those surfaces that we were
surface,
talking
absolutely, great question. Take a look at the products that you're using, and you can check out the EPA has information about the disinfectants that they have approved for. Look for things that will effectively clean against human coronaviruses. Because the common cold, about 40% of them are actually caused by a type of coronavirus. So look for the human coronavirus capacity as well as for flu, and then you've got yourself covered on that aspect as well. And the other question?
The last question was, are there over-the-counter medications that we can be taking to prevent?
Okay. I'm going to approach that slightly differently. We do need to think about prevention. Unfortunately, and this is just a reminder, we currently do not have any medications to treat or to prevent coronavirus. And there is no vaccine, although they're working on it. What I would talk about for prevention, though, is in some ways, we need to do the usual habits of exercising and eating right and sleeping well so that your immune system is able to fight things, okay? It's a type of prevention if we take care of ourselves, and at these times, it's really seems like we shortchange ourselves on that. So think about those things to help prevent yourself from becoming sick. Have the best you can possibly be to fight any sort of infection.
I do just want to pull on that thread about the cleaning of offices and surfaces, because we had some internal conversation in the county just a few days ago about ensuring that the people that clean our offices are using the appropriate materials to deal with. And actually, we found that what they'd previously been using was not quite up to fighting the coronavirus, and so that was changed. And that's the kind of thing that anybody who has a space can clearly look at.
I would also just add, sorry to interrupt, but I would just add that to read the directions and follow the directions, that a lot of the cleaners say, make sure you let it dry, or wipe for 60 seconds, or, even with the hand sanitizers, a lot of the instructions are you must rub together and let dry for 60 seconds. So make sure you're following those manufacturer recommendations, because that's the only way that you can guarantee that the what you're trying to kill actually is decontaminated.
Good, great, thank you, Kate. So we have a question that I think touches, sorry, Doctor, back to you again on this whole issue of international travel. And the question is, how is Arlington County identifying travelers from the COVID-19 affected areas?
Okay. So we get that information from the CDC, who then gives it to the Virginia Department of Health. If those are the countries that have been specifically told to be identified, we get the travelers' names, their contact information, and then it's across the U.S. that this is happening. So we would get the travelers coming into Dulles, and we have teams in the health department who have been trained to contact these individuals, and they've been doing a great job. We've actually, and this is a model I think for businesses in general, we've been looking at our continuity of operations plans, and so we've changed up our operations so that we can make sure we can supplement the teams who are actually following through with the travelers, so that we can make sure we're ready for a marathon here rather than a sprint, so our staff are supported and not exhausted.
Understood. Really great question from Annie, who just asked, if this is a respiratory virus, why is everybody emphasizing hand washing?
And the entire purpose is that it's not always through respiratory contact that you're going to get the spread of germs. I think a lot of people actually, unless they're routinely in very close proximity, the more common ways to actually get germ transmission that leads to respiratory illness is respiratory germs on my hands, and I'm not going to do it, but touching my mouth, my nose, or my eyes. Those mucosal surfaces are exactly how germs, especially respiratory germs, can get into the system and cause respiratory illness. So it seems counterintuitive, but not everything is going to come through the air to cause respiratory symptoms.
Understood. Sorry, we're sticking with you given the questions that are coming here, not surprisingly.
Not surprising.
So we have a question about what's the plan in the county if the coronavirus is detected in a school? Sure. And Mark, you may want to talk too about your relationship with the superintendent after Ruben gets done with the...
We have, first of all, we have school health nurses in the schools that are public health trained. They work with Arlington Public School staff routinely. We've been working with them, and I know that they have been looking at their pandemic plans and re-emphasizing things, and we've helped craft messages, and I know they've been putting those messages out. We just met this afternoon with the Archdiocese of Arlington to talk about what they're doing in their schools. So they are communicating with us, we communicate with them. We routinely deal with outbreaks. So once again, if we were to find a case, it depends on the circumstance at that point. We will then work with the school systems, and depending on what the circumstances with county government, to make the best recommendations. And this will be done in consultation with the Virginia Department of Health and the Centers for Disease Control.
So it's a case-by-case basis decisions will be made based on the circumstances
At that time.
Right.
Exactly.
Mark, you want to talk just a little bit about your relationship with...
We're in constant communication with our colleagues in the schools, and I think in a situation like this, it's actually going to be Ruben, Dr. Varghese, who's going to be contacting the public health staff that are in the schools to get the best kind of information. As far as a decision as to whether a classroom or a school should remain open or not, That's not something where I'm going to sit here and tell you this should happen or that should happen. It's going to be dealt with on a case-by-case basis, and I think the superintendent in the past has always consulted with our public health staff, and we try to make the best decision we can. And I would just use this opportunity to remind people, if your kid is sick or displaying any symptoms, the best thing that you can do is keep that child home with you. And that is the best way to make sure that the classroom ends up being a place where kids can come and do what they have to do to learn.
Good. This question I'm going to give to both Kate and Aaron. Aaron, just talk a little bit about, there are people in every community, and certainly ours, that we refer to as the vulnerable population. Those people don't have access to the same kinds of services and amenities that many in the community do. What do we do when we have a situation like this for that portion of our community?
Yeah. So that's a great question. Once again, our public health division, our Department of Human Services at the county has extensive programmatic support, particularly for members of vulnerable populations, through their regular contact methods as direct service providers, or in working with, for instance, healthcare providers, hospitals, home health providers, and other organizations. For several weeks, they have been providing them guidance and recommendations in consultation with the CDC and the Virginia Department of Health to be able to address any special needs or special particular items to pay attention to. As I mentioned, we do that on a regular and routine basis. And because we do that, it only makes our response in these instances that much stronger.
And Kate, more specifically, Mary wanted to know, for her mother who suffers from Parkinson's disease, is there anything particular that she should be looking at? And we may pivot to Dr. Varghese on this also, but thoughts about, when we would respond, or when the fire department would respond to something like that.
Sure. I mean, I think that the same advice that we have been giving all along applies to the vulnerable populations as well. Obviously there's a higher threshold that if you're coming down with illnesses, a vulnerable population has a fever or shortness of breath, or those are reasons that, really you should involve your 911 services, and that would be someone who's appropriate for a 911 type response, and accurately giving dispatch that information, why it is that you are concerned that this is a potential for a person with COVID-19. We've had contact with somebody with who has traveled, or, there's a concerning symptom. Otherwise, a great relationship with your primary care doctor is vital. And I think for everybody, not just patients with chronic disease, but having someone that you can turn to ask questions if you're concerned. And then, of course, all of the resources that we have available on our websites and through Arlington Alert and through everything that this panel does for you.
So, Dr. Varghese, we have a question from the Arlington Partnership for Affordable Housing, APA. What about communal spaces in apartments and group activities with kids and volunteers?
Once again, I think it's a great question, but I think it's similar to even the playground questions and community meetings. The primary way most people get ill is coming in contact with people who are sick. So even though there are concerns about asymptomatic transmission, the most transmission of germs and spread is through contact with people who are very sick. So we're going to recommend, once again, remind people to stay home, stay in their apartments if they're ill. If they need help, help them get the care they need to stay put. Because that's the thing that we as a community, I think, do well. Let's remember our neighbors, we're part of a village. Let's help take care of each other. Let them get better while they're there. And then once again, in those common communal spaces, like you're running a business, are you taking care of the cleaning of those surfaces frequently? That's how with the appropriate products, so that people reduce the exposure to germs in those settings, because we want people to be able to congregate safely. And so that's the continuity of operations that I would encourage groups even like APA to consider.
Good, good. Here's one that anybody living in Arlington will recognize the attention that a question like this gets. But should I be concerned about my dog getting ill with coronavirus, and should I manage their time at the dog park as a result?
It's a great question. sure yet what the ability for human to dog transmission or human to pet transmission. It's not typically the direction that things happen. And so I would say work with your veterinarians if they're ill. If they think there's something unusual, they will there's actually a state veterinary system. They will be consulted as well and work with public health if for some reason there's a belief that there's something spreading among animals. I think that, once again, get your pets out, let them go to the dog park, let them play. Fresh air is always a good thing.
Good, good. We are still getting some questions about testing, and this is not a surprise given the reporting in the media. You've touched on it a couple of times already, but one of the questions that we're getting now is, what should someone do if they think they are ill? Where should they go for testing, or where should they go for advice, directly?
Excellent question, and I understand why testing is something that people want to know about. So given some of the recent changes, establish a relationship with your primary care provider. And what we're saying is call them before you show up at the office so they can safely see you, okay? Talk to them. They can always talk to us about whether it's appropriate or not. The capacity in the US for general testing for coronavirus is still not going to be as quick as the federal government or any of us would like. So what Virginia has decided is they'll follow the CDC instructions previously, and if necessary, if it seems appropriate, they will send the remainder of the testing results to the CDC. We anticipate that the private sector will be able to start doing laboratory testing. I just can't tell you when those agencies will be able to do it. And this is not the type of thing that's going to be ever over the counter like a pregnancy test, which, if that's what people are hoping for, that is not likely to happen anytime soon. And the system is working to increase the testing capacity.
Good, good. So we got a question that actually came in before we started, and it probably falls in that whole area of quarantine. But the question had to do with, is there a chance that Arlington residents will be asked to stay in their homes at some point?
Well, it's a great question. I can actually say we already have asked some Arlington residents to stay at home because of the traveler program and those who've been identified who need to be either voluntary quarantine or voluntary isolation. This actually happens much more often than people are aware on a day-to-day basis. We ask a lot of people. We have over 75 communicable diseases reportable in the state of Virginia, and we work with people all the time to do that. Now, is it possible that it could be done in a more mandatory fashion? Anything is possible. I don't anticipate that likely to happen either in Virginia or in the US because of the way we balance both privacy rights and individual rights with public policy.
This next question, I'm going to start with you, but I'm actually going to ask everybody to sort of weigh in on this because things today in Arlington are pretty normal. All right, people are going about their lives. We are encouraging them to take some extra precautions through all of those things that we talked about before, with hand washing and perhaps questioning whether or not shaking hands is a good idea at this point. What are we looking at a month or two from now?
Right now, there's no clear evidence of community-wide spread here in the National Capital Region, because I'm not just going to talk about Arlington. We cross our borders, so I think we have to remember our community is DC and all the suburbs. We crisscross that. Right now, we don't have evidence of community-wide spread. When that happens, I'm not going to no longer say if, but when, we need to realize it really depends on what happens for the people in the area. It may be more that people are ill and not getting quite sick. What are the absentee rates happening? Is that why people are going to be making decisions about whether they need to change their business operations? I think people are concerned, when are we going to close X or cordon off whole communities? Unlikely to happen here in the area. I don't think those things will be necessary, and we have the capacity to respond if necessary.
Kate, first responders are human beings and susceptible to these things.
Absolutely.
One might argue that they may even be a little bit at higher risk given the environment that they work in and the people that they can be exposed to. We've talked a little bit about continuity of operation plans, COOP. Why don't you talk a little bit about what the responder community is looking
Sure.
at if they were losing
Sure.
people?
So we extensively researched this with the H1N1 outbreak, and we have a quite extensive document that is currently being updated and being, prepared to have these plans in place. That what happens if 30 or 40% of our workforce is unable to come to work? How will that affect our operations? How will we continue to maintain the quality of care that Arlington citizens have come to expect? So it is certainly something that we are at the forefront of our brains, and trying to keep our staff safe and healthy is our number one priority to start with, so that we can respond in the capacity that we have. People are accustomed to. So it's certainly something we're thinking about. We have plans in place. We are working on having those contingency plans about how our operations would change. One of the things that I talked about already is the teletriage type option is having some sort of remote medical screening that citizens can call in for to have their questions answered, and then if resources need to be dispatched, to making sure that those are the appropriate uses of resources.
Good. Aaron, your job as emergency manager is to coordinate a lot of the resources across the individual departments and functions of county government. Again, this idea of looking forward a month or two, why don't you talk a little bit about where your resources will come from, perhaps the repurposing of resources, if we have to focus more intensely on this particular problem?
So the partners in public safety, the fire department, are not alone in assessing their continuity of operations plans. All of our departments have been taking a look at their continuity plans and establishing those services that are critical to the function of government and to continue to serve our residents in our community. And so we regularly not only assess that and encourage, and I'll use the Department of Technology Services as an example, right? They are currently assessing our technology infrastructure, and while it is a very robust network that allows us connections both inside and outside the network, and a lot of other ancillary benefits, we're looking to figure out what the stress points are on that system and how, in this particular instance, we can ensure that we're mitigating any gaps and identifying those now ahead of time. We have a wonderful set of community volunteers as well that help augment this process. And I'll recognize two of those groups that I think, one of which is already providing some additional support to Dr. Varghese. That's the Medical Reserve Corps. That's a community volunteer group made up of medical professionals, doctors, nurses, as well as parahealth professionals that provide some additional capacity. And then the Community Emergency Response Team is another wonderful resource that we utilize. We have over 700 individuals now trained throughout the community to assist us with basic preparedness efforts, and also have specialized training in certain areas of disaster preparedness and disaster management that we can leverage as force multipliers. It's really important right now that all of our departments are sort of walking through within this phase and assessing those plans and working with those groups where necessary to determine what our bench strength is and to play out a variety of scenarios.
And if somebody wanted to become a CERT member or join the Medical Reserve Corps, where would they go? What would they do?
Yeah, so the easiest thing that I can encourage folks to do, readyarlington.com. And there's a big button on there about becoming or staying engaged and staying involved. And it has resources about a number of our volunteer opportunities, including the Medical Reserve Corps, the Community Emergency Response Team, as well as a few other opportunities.
Just wonderful assets that really do speak to the limitations of government. We don't have all of the capabilities, and obviously a more ready community helps when we're facing something like this.
Absolutely.
Jim, I did want to add one thing, which something that has come up in the past when we've had big snowstorms, where sometimes we have all these resources and these assets, and people are shy about asking for help. And I know it sounds like we have a lot of people who are engaged tonight sending in questions, but it's going to sound trite, but check on your neighbors. I mean, we are, as Ruben says, a village, and you are the eyes and ears a lot of times for things that we'll never know about. So check on your neighbors. Feel free to ask us questions. And I think at the end, we'll tell people if they have further questions, what it is that they can do to get in touch with us. But I have found in my many years of public service that we hear from some people a lot, but sometimes the people who really need the help are shy to ask for it.
Actually would like to emphasize that point. The vulnerable need our help even more at these times. So they live in your neighborhoods. Also, to the point of continuity of operations, government and businesses and nonprofits, it's a triumvirate there. It's a trinity there. You have to have all of these groups. We rely on them now. We will rely on them also in these situations. So this is why business continuity of the business sector and the nonprofit sector is just as vital. Start thinking about what you would do if you had the absentee rates and so on. What are your critical services? What can you cut back on to help support the whole community in this effort?
So, Dr. Voorhees, we have a question from Joan, who I think was listening to some of the earlier comments, and asks, is there any point to going to the doctor in the early stages of a fever illness? Is there any medicine like Tamiflu for coronavirus? And if not, I might as well stay home.
In general, with coronavirus, we're seeing it's mostly mild. So if you're doing well, staying at home is actually the best thing, and keeping hydrated and is probably the most critical thing, and taking appropriate anti-fever medications would be the best things to do. There are no medicines to prevent the advancement of coronavirus like with flu, which has Tamiflu. Is there another part to that question? I can't remember.
Just what advantage is there actually to going to the doctor in the early stages?
Early stages, if you are not feeling poorly and it's a fever and just feeling tired, you should stay home and hydrate. If you need to, you can always call your doctor, say, at what point? Obviously, if you're not doing well and maybe hospitalization is necessary, call your doctor, let them see you safely to make that decision together.
Aaron, this question I think is right in your lane, in part because you're not just, we keep referring to you as the Director of Emergency Management, but you oversee the 911 Center also. So this question comes from somebody who says, my mom only speaks Spanish. I'm worried that she's missing the message. So that's one. Are there translated materials available? And then secondly, what happens when she calls 911?
When residents within Arlington County call 911, we are fortunate to have a number of our public safety telecommunicators, our dispatchers and our call takers that are Spanish speakers and also speak a few other very common languages for our Arlington community. That's a wonderful resource that we have. Some of them are native Spanish speakers and also have additional language skills. On top of that, if there are specific dialects or if there are languages that we may not have on staff at that time, we utilize a language line service. And that service is one that is used by other 911 centers. So it has certain availability, certain high availability of specific languages, and allows us to communicate with those residents who we might not have someone who's fluent in that language there with us. As far as materials, and I'll let Dr. Voorhees speak a little bit to this, but the Public Health Division, as well as county government as a whole, endeavors to make materials accessible in a variety of formats and languages. And you'll see, for instance, the Center for Disease Control information that's been posted behind us this evening. That is available through the public health website in not only English, but also Spanish and some other additional formats. And I'll let him talk about those materials.
Thank you, Aaron. For this situation, and we've gained experience through the pandemic experience, we typically, in addition to English and Spanish, will translate important documents into the top 5 languages that are seen beyond those that our Arlington Public School System sees, so that we can have the best range possible. So in this situation, when we first started, though, we also did simplified Chinese because of where people may be traveling from. So we also adapt, and we have access to professional translation services to get those things done. And we've been doing that on all important communications.
Great. We are unfortunately out of time for our discussion this evening. I want to thank all of the members of the community who participated tonight by sending us questions. The questions that you send us, we're not just thinking about what it is that you're asking and giving you an answer, although I hope that has been most helpful. But your questions also help us to understand what's going on in the community and how we can ensure that we are getting our messaging right and that we are thinking about how we are arraying our services during a time like this. I think, as Mark indicated in the very beginning this evening, this is likely not the last time that you will see this kind of format. This is an incident, a set of circumstances, this particular outbreak that is going to be with us for a while, in all likelihood. And so look for more broadcast forums like this where we get an opportunity to share information with you and perhaps hear back from you at the same time. If possible, if you have additional questions, we want you to go to our website to try and gather information there. And by all means, if you have more questions, use the address there on that website to provide those questions to us. Again, that website is going to be changing quite frequently as we get new information around all of this, and the CDC website is also a great resource for you. Lastly, if you are not already signed up for Arlington Alert, this is a great way for you to get messages directly from county government during any kind of a crisis, and it is a way for us to target information to you about a particular set of circumstances that you might find valuable. That also, the registration for Arlington Alert can also be found on the county's website. Thank you all again. Thanks to the panelists for participating tonight. Thanks to you in the community, and we look forward to talking to you more in the future. Thank you.